Hi, my name is McKenna Pozeg, and today I'm going to be showing you the synovial joint that I made. So as you can see here, I made the right knee, and this is fully functional that can move, and I'm going to be showing you how I created it. So let's get started. For day one, I created the bone, so I created the tibia. And then on day two, it ended up breaking. I also made the femur and I added the condyle on day two. I also created the fibula and labeled it with the blue on day two. I then realized that I wouldn't be able to make it move unless I added some toothpicks sticking out of it. So I scratched the first one and I made a new femur on day two. On day two, I labeled this one, and when I was recreating it, because the other one broke, I added the toothpicks, and then it ended up breaking again. So I'm gonna start this project from scratch and go with a different approach. This is day 4 or 5, since there was like a day in between so I could let the clays dry. So let's just say day 4. And now I'm gonna rebuild everything from scratch. You know, they say third time's a charm. So let's get started. So I created the fibula and the tibia, and I also added zip ties in the middle so that it can move, and those are acting as the anterior and the posterior cruciate. So now I've created all of the bones, including the fibula and the patella, and they're not attached yet, but you can just imagine the fibula will fit right along the lateral side of the tibia, and the patella will sit on the anterior side of the femur. And I'm gonna be attaching the fibula with the toothpick, and then I will attach the patella at a later time with hot glue. Now the fibula is attached with a toothpick up here and a toothpick down there. So now this is day 5, and this is what I have done so far. I have added all the anatomical landmarkings. So specifically, this is the right knee. So starting with the femur, we have the epicondyles. So over here, you can see it's marked with the red on the legend. So this would be the medial, and this would be the lateral epicondyles on the femur, because this one is closer to the middle of the knee of the body, and this one is further away. And then moving down, we have the epicondyles on the tibia. And once again, this would be the medial epicondyle and the lateral epicondyle. And then this purple shade in the middle on the tibia is the tibial tuberosity. And moving down, this blue clay on the side along the crest is the tibial crest. Now looking at the posterior view, we have the condyles. And so this would no longer be the medial, and that would no longer be the lateral. Instead, this would be the medial, and this would be the lateral, because it is flipped. So adding on to day 5, I added some tendons and ligaments. So if we look over here at my sculpture, you can see in the middle here are my zip ties, and these are acting as the cruciates. So in mine right now, I do not have an anterior and posterior cruciate, but you can just imagine one crossing over the other one, which will create an anterior and a posterior cruciate. Then if you look over here in the middle, you can see all of the meniscus. And if you look over to the left on the lateral side, you can see we got the fibular collateral ligament, and this holds together the femur and the fibula. Then if you look over to the right side, we have the tibial collateral ligament, and this holds together the femur with the tibia. For these ligaments, I used rubber bands that I cut in half, and then I hot glued them to the sides. And these ligaments help the kneecap to stay in place and not move around. And it does look like my knee has osteoporosis, so just bear with me and its weak bones. So if we look at the posterior view of my joint, we can see the meniscofemoral ligament, which connects on the back of the femur, and it is this beige color rubber band right there. So after a week, this is the final knee joint that I have created. So looking at the anterior view and now the posterior view. So now, once again, here is a legend where you can easily find any part of the knee with the corresponding colors and the names. Thank you. I hope you learned a little bit more about the knee.